welcome to the Psychohealthology Summit 2018. Thank you so much for joining us. I'm your host, Dr. Eva Detko, and my guest for this session is Sherazad Rouhano. Sherazad is the founder and director of Rhythmia Breath, a science-based well-being program focused on achieving the best possible clinical outcomes for specific chronic conditions by combining modern medicine with holistic practices. And Sherazad is a clinical nurse specialist specializing in cardiac arrhythmias. She's also a yoga therapist specialized in dealing with cardiovascular disease, cancer, and autoimmune conditions. And she deeply believes that our mental and emotional health are key aspects that should not be overlooked when dealing with autoimmune conditions. And in her own words, we must remember that what we think and believe will be stored and experienced in our physiology, but we certainly can influence our immune system by the direct conversation between our mind and our heart. So Sherazad, welcome to the Psychohealthology Summit. Great to talk to you, great to connect with you. Welcome to the summit.
Hello, Eva. Thank you so much for having me. It's an absolute pleasure. Thank you.
Well, I am excited about what you're going to share here today. And also people will have an opportunity to experience on a practical level what Rhythmia Breath methods, the process that you've developed, what that's all about, because you're going to do a practical session as well for us, which is absolutely amazing. So I'm going to ask you first, what's led you into this area of work? Can you perhaps share your story with us first?
My personal story and how I ended up doing what I do, it comes from a personal experience. 7 years ago, approximately 7 to 8 years ago, I was diagnosed with an autoimmune condition that it's called Graves' disease. And I'm sure that most of you know that it's a very nasty condition that affects the thyroid. So it's the most common cause of hyperthyroidism that, it exists at this moment. But it can lead to so many problems that also damage your immune system. So I was a very healthy person. I'm an ex-ballet dancer. And I was working in cardiovascular research by that time. So, and I started developing all sorts of funny symptoms, palpitations. I was losing a lot of weight. I was eating a lot. My eyes were getting so dry. And I just knew there was something not quite right. Funny enough, the first time I went to the doctor, my thyroid level was just very borderline. Okay. And as we know, when your thyroid start just playing up, right? It's some labs will say it's completely normal, but I was feeling so bad. I was feeling so awful. Anyway, a couple of months later, I developed what it's called a thyrotoxicosis. So basically, my thyroid was absolutely crazy, and I was laid in bed for almost 2 months without being able to move, without being able to go to the loo myself, and it was just horrendous. As a consequence of all that, I started doing yoga, restorative yoga, and I just had to change my life drastically and completely. I went to see a nutritional therapist who helped me. And this is basically how I started that. So, and then I specialized in yoga therapy for people with autoimmune disease, cancer, and cardiovascular disease. And so basically I start applying what I did with myself to my patients.
Awesome. Yeah, well, yeah, like so many of us, it's a very, very similar story for so many people. And then you've gone on to develop Rhythmia Breath. So tell us what it is and what it aims to achieve.
So basically, Rhythmia Breath is a well-being program that combines modern medical care with holistic or complementary practices such as yoga, mindfulness, pranayama, which is part of yoga, obviously, meditation, mindfulness, and nutritional therapy. So our aim is to bring these two sciences in partnership. For very specific chronic conditions. We mostly deal with cardiovascular disease, autoimmune conditions, stress and anxiety, and some form of cancer. Each condition within our program in Rhythmia Breath has a set of protocols and interventions that should actually be led carefully, led and followed carefully if we want to achieve the best results in the recovery process. So the method involves multiple approaches, and some of them are used simultaneously, but they will all have one thing in common, which is making our patients or clients aware that their specific condition needs to be taken care through different approaches and interventions. And with this, I mean that sometimes, especially with very aggressive forms of autoimmune conditions, as you know, as you're well aware of it, it is paramount having the regular medical care in place first. And having had this, then we can also explore different forms of intervention that do not put the person at risk. So basically, Rhythmia Breath is somewhere in the middle, right? We're trying to bring these two sides in, as I said, in partnership and in peace, so the person can actually get the full benefits of both of different worlds, the medical care and the holistic.
Yeah, it makes sense, absolutely, because yes, absolutely, that's true. A lot of people here will know this already, that we always encourage getting to the root cause, and that is ultimately what people should be aiming for. But as you rightly said, if somebody has severe symptoms, they do need that life jacket to begin with. And of course, it's absolutely recommended and logical to go down that route first, whilst you're then making changes and making those adjustments. And sometimes the body is so compromised that you have to make those changes really slowly. There's a high level of sensitivity to various things and all sorts of things like that. So as you making all of those changes and medication is supporting you, then you at some point you may get to the point where you figured out what the main issue is, what the main triggers are. And once you remove those triggers, you can then reassess and possibly, hopefully, get off that medication, right? Is that basically your approach also? Yeah.
Yeah, it's basically how the protocols and intervention works. Yeah.
Yeah, and you selected specific holistic modalities. So tell us a little bit about your rationale behind selecting those specific ones, because there's hundreds of holistic modalities out there, right? So tell us a bit more about your approach.
The reason why I use these modalities is because it's actually quite straightforward and simple in a way to use them, right? As you said, there's so many different modalities, but as this project comes from my experience, I'm using what I know that worked. And also what it's really important for me is to have the scientific evidence behind what I do. So I've read thousands of research studies showing that yoga is so, beneficial for cardiovascular disease and autoimmune disease, and also mindfulness, meditation, stress management, nutritional therapy. And so this is basically the reason why I decided to use these alternatives or this type of medicine that there's already research backing this up. Because our main source of referrals are consultants in the medical stream. So when I presented this project to them, they need to have the scientific evidence proving that what I do has been already tested. Although I would love to use many other, complementary, or I don't really like to use alternatives, but complementary techniques. These are currently the ones I decided to implement in the program, and so far it's working fantastically well.
Yeah, it does make sense, because of course there are a lot of modalities out there that work absolutely wonderfully, but for one reason or another, and that could be very simple reasons, like for example, certain modalities don't lend themselves very well to placebo-controlled trials because of the very definition of what they are. such as hypnotherapy, for instance, right?
Yes.
It doesn't mean that just because there is not thousands of placebo-controlled trials, double-blind and all the rest of it, doesn't mean that modality is not being proven to be effective. It just means that it's not easy to research. Secondly, of course, big pharma rules. Everybody knows that. If anybody thinks it's any different, then they're just being naive. So basically, this is something that if we're talking about modalities that people can just easily use on themselves, then there is a lot less funding available, and the people who have most money, which is the pharmaceutical industry, are not interested in investing in this, because if you can use your own body to heal yourself, where they're going to make their money from? They're not going to, so there's all of that going on. But the bottom line is this, that you selected those therapies that basically mean that those people who would be otherwise just shut down completely to any complementary approaches are now listening to you and are integrating those approaches and are referring patients who would probably otherwise not even know about any of this or what you're doing, because those doctors and consultants wouldn't bother referring them. So I think that's you're being very clever to kind of, in the way that you're marrying the two together. I completely understand your thinking behind it.
Yeah, I've just tried to make things easier for people to get access to services like this. Because if I implement all this, I'm such a huge fan, for example, of homeotherapy or bat flowers. I love them, but if I want to approach a consultant, quite narrow-minded, and I show him the research studies, he's going to refer that because there's medical proof, there's scientific evidence behind, as you said. So it is a clever way, but on the other hand, it's also the easiest way to make this available and approachable for more patients.
Yeah, brilliant. So tell us more about your methodology from the point of view of promoting emotional health and well-being.
I absolutely love this question, and I'm so passionate about explaining this. Before jumping into what I really do, I'd like to explain the definition of what is an emotion and how it affects our body, right, in many different ways. Because also the way we think and the way we feel can affect significantly the way we breathe. And a lot of people are not aware of this, and a lot of people don't know. So in simple words, I'll try my best. An emotion is a subjective and conscious mental reaction towards a particular event, anything that happens. And it usually comes along, or it's accompanied by changes in our physiology and our behavior, right? So that's an emotion. So when we talk about emotions, we also should be mentioning things like memory, experiences, changes in hormonal levels, and lastly, the fact that an emotion can also have a negative or a positive charge. So depending what type of emotion is that, it can affect us in one way or the other. So literally, our thoughts have the power to become ingrained in our physical body in the form of symptoms. Okay, most of the times it's tension. This is what I see as a yoga therapist, right? I also observe people's body and also try to see what's in their mind. So it's a bit more complex than only doing a yoga session. So as I was saying, these symptoms are reflected in our bodies in the form of tension. For example, tension in the shoulders and the neck and the intercostal muscles. And all the time see through symptoms of abdominal discomfort, where, ulcers are the highest manifestation of anger stored in our abdomen. So when things like that happens, our diaphragm gets constricted in a way that people develop this form of breathing, which we call reversed breath. Okay, it's literally people that are holding a lot of carbon dioxide and they tend to hyperventilate. Right, so now people will have an understanding of how emotions and thoughts can affect the physical body, how we act and react, but ultimately the way we breathe. And the way we breathe and the way we think is connected. A lot of people, when I say how stressed are you? I'm not stressed. I'm not anxious at all. I have a really nice life. And then they have like, oh, really? I don't really think so. And then as you, as you start the session, as you do 2 sessions, 3 sessions, they start opening up, so emotions are, now flourishing, and then they feel more comfortable, and they start saying, well, my brain is just playing up with me all the time, and this and that. So basically, Eva, what you see normally does never reflect what you think, but the way you breathe will reflect how you see the world.
Yes, yeah. Oh, that makes perfect sense. I completely agree that a lot of people don't think that they are stressed or anxious. And this is partially to do with the fact that they may have been in this state for many, many years. And therefore, they've almost become desensitized to the fact that they are. So they don't see it as something that is a symptom or could even lead to other symptoms. They're basically often associated almost with their identity, and they will say, it's just the way I am. I'm just an ass person or whatever, right? But of course, as we know, that can massively interfere with healing.
And all these things later on, Dr. Eva, it comes in a way that, where the only way out is through medication. I've seen so many patients having antidepressants and having tablets for anxiety, tablets for this and that. And what's really going on is that huge disconnection between what I want, how I feel, how I think, and how I breathe. So I'm not saying that I've taken people off medication, but certainly I've seen very clear cases where they are like, this is what I needed, for so many years. Someone that just showed me that the way I think can affect the way I breathe, and the way I breathe can affect the rest of my body. Okay. And I've certainly seen, people coming off tablets after our programs. Definitely. I've seen this many, many times. And our doctors have seen that too.
I can totally believe that. So could you just elaborate a little bit more about the fact that if people are going to heal, then they need to oxygenate the body correctly. And that's obviously another reason why this is so effective, right?
So let's talk a bit more about breathing and about why is it so important. The breath is not only serves as a modulator for our heart rate and respiratory rate, but it also has the power to slow down our thought process, and as a consequence, calming the mind, right? The breath has also tremendous power in the healing and recovery process. It increases the heart rate variability, which is a measurement that shows how your heartbeat changes from one beat to another. And it is an important indicator of the health of our heart, and stress has a lot to do with this as well, right? So basically our breath not only serves as a physiological tool to regain health and increase the oxygenation of our body, but most importantly, it connects these two, as we were talking before. It connects what we think with how we feel. Right, and apart from all these well-known benefits of increasing oxygen consumption, releasing carbon dioxide, and this very detailed explanation, the most important thing that I always try to teach my patients or my clients is that the breath is basically a modulator for your life. Right, and what you think and how you feel, it can be actually managed through the way you breathe in.
Yeah, and we were designed to breathe in a certain way. And of course, when you think about how long you can go without food and water versus how long you can go without breathing, you straight away realizing just how massively important that is. But of course, the problem we're having today is that people are in this chronic state of stress. And therefore, as we know physiologically what that means, and people may recognize themselves do that, when you are in a state of hypervigilance and your stress hormones kick in, your breathing does get more shallow, And so people may already be aware that they're doing it, but equally they may not be aware that they're doing it, because if they're constantly chronically stressed, that, as you said previously, a lot of people just have a superficial way of breathing, and they're breathing like that all the time. So therefore, not breathing to the sort of full capacity, really restricting the capacity, and therefore restricting just how much oxygen gets into the system. And of course, that is what fuels metabolism, and that is what fuels healing. So if we cut that short, everything falls short. That's the problem.
Yes, that's exactly what happens. So, people walk around with this conscious, tightness on diaphragm, and then that very little expansion on the ribcage and on the lungs, and as a consequence, there's a huge, as you very well said now, there's all sort of hormonal dysfunction around that. So there's a really, really nice research study that the tightness in this diaphragm has actually affected the way the vagus nerve behaves, and that's also a huge problem nowadays, that people are experiencing syncopes or dizziness, fatigue, and it's all because of the lack of breathing, the lack of awareness of how to breathe correctly, right?
Yeah, excellent point. Exactly. I wanted to ask you when, say, people are starting to be more aware of themselves, and I think that's the first step, isn't it? It's actually have that awareness. What would you say in terms of your tips on how to perhaps retrain ourselves to breathe more fully, correctly?
Right. So there are certainly many techniques that I use personally. But my favorite one is the Shavasana, the practice of Shavasana, and starting just focusing on the expansion of the rib cage, right, more than the belly. For example, there are many contraindications with the belly breathing in my area, in cardiovascular disease and in some form of cancer as well. So I just make them really focus on the expansion of the rib cage and the lateral and back of your lungs, right? We use all this very funny equipment like a rubber band around your rib cage, and then to notice the expansion in and out. So this is basically one of the techniques that we use. But then you will see, I see this every single life, every time I have someone new, that the movement of the ribcage and diaphragm is just like non-existent, is not there. So by us just simply placing this rubber band here and teaching them how to expand, and contract the diaphragm, that's one of our techniques. And you can be practicing this for weeks and weeks and weeks and still having a very poor control of your lateral of your secondary muscles, basically, when you inhale and exhale.
Yeah, no, I was actually going to ask you exactly that. What you're seeing in terms of progress? How long does it usually? I mean, everybody's different, obviously. That's always a very tough question. But in terms of your recommendations and what people sort of managing people's expectations, how long it will potentially take them to get to this, let's say, full expansion, if you will.
So, to be completely honest with you, Dr. Eva, it's a very tricky question, and it basically, as you said, it depends from one person to the other. But I go on and on and on and on all the time. That consistency is a key, like everything else in life, right? You need to be consistent. It doesn't really matter if you practice 2 hours a day, or you can only practice 20 minutes, or you can only practice 4.5 minutes. What's most important is how dedicated and focused you are when you're doing your practice, right? I've also seen people that say, I practice 45 minutes every morning. It's like, fantastic. And then where's your mind when you do that, right? How focused are you on that? So I prefer if you just do 5 minutes, 6 minutes every morning and every evening before you go to bed, you oxygenate your body, use your hands or your rubber band, and just be conscious and focus on what you're doing, right? Because it's also very easy to have our minds drifting away when we breathe, right? So I would say it's a very, very, very short time, 5 to 6 minutes, be very focused, and every single day. even weekends, because people think that, oh, it's a weekend, I can take it off. It's like a diet. It's like, no, you breathe every day, right? So why don't you practice every day? People are so funny. So yeah, every day consistency is the key.
And that's it. And people will hear that message time and time again. It's not about the length of time as much as it is about consistency. Whatever practice it is, whether it's yoga, meditation practice, breathing practice, I do often, tell people to place their hands on the ribs, or if they're doing belly breathing, on the base. So keep themselves in check. So I like that. So that's a really good tip, isn't it? Because it just keeps you focused on that very action that you're doing, and it keep bringing yourself back to that, even if your mind drifts, because our mind drifts. Stopping your mind from drifting is not easy, particularly if you're not trained to do that very well. But it's about bringing yourself back into what you're doing, and I suppose having that connection between the physical connection with placing your hands on your ribcage, that does help a lot, doesn't it?
Yeah, and I also deal with a lot of people that are extremely stressed, and they say, well, I don't really have time during the day to practice my breath awareness, Sherry. So, okay, so when you're sitting in the office, when you're sitting on your car, on the bus, on the tube, just stop and just ask yourself, am I present? Am I breathing? How am I breathing? I always show them the 4 qualities of the breath that comes from Richard Rosen. It's a quite complex method, but he put it beautifully in these 4 statements, the 4 characteristics of the breath. So I always say to them, just sit down, pause. Where am I breathing? Am I breathing with my belly? Am I breathing with my chest? Is my breath, shallow? Am I inhaling and exhaling properly? Am I holding my breath? Even that, it's enough. Right? And even if they do 2 minutes, everybody has 2 minutes to spend on that. So that's another tip that I always give them. And it works because it's a way of they're working with the mind, they practice mindfulness, and they're doing their breathing exercise, right?
Yeah, well, exactly. Yes, you're doing 2 things at the same time. And also, after a while, this is something that we can retrain. So after a while, it does actually become more natural. And people will find that at the beginning, every time they stop themselves and ask themselves, oh, how am I breathing? Is it shallow? Is it this? And is it that? They find that it's not what it's supposed to be. But as they do it more and more and more, and they keep asking themselves these questions, it's more what it's supposed to be, right?
Yes, and I have very, very funny cases, and I can share one with you. It's this client of mine that I've been seeing for almost 2.5 years. And a couple of weeks ago, he said to me, you know what? I now realize that the minute I sit in the car, this is when I have to do my breathing exercise. It's only when he sits in the car. Every morning before he goes to work, he sits in the car, he does his 5 minutes of breathing, and he's very present. And as the brain only needs 21 days to make habit, and he's been doing that for so long that he's now like, it's his habit, right? And now he's like, there's nothing else I do, just sit in the car and I practice my breathing, and I put my hands here. And that's it. That's my breathing practice for the day, Sharon. Like, fine. If that works for you, it's perfect. But over the time, you can see that is clearly working. Without him realizing, he's doing mindfulness, he's doing that meditation, and he's very focused. And at this 5-6 minutes a day, his mind, it's completely off his stress, right? And he's practicing, meditation without him realizing.
But that's interesting because he has anchored himself to his car, and that is working for him, and that's brilliant. But you know what? People can anchor themselves to all sorts of other things, and it's the Pavlovian dogs. That's how the brain works. And it may be that if you start doing it regularly in a given context or in a given situation, your brain will then connect with that in this situation. And then after a while, every time you're in the bathroom or your living room or wherever you are, that will kick in. And so that's a great little tip, really, and great that our brain does work that way. Of course, sometimes it works that way in a negative way, but we can also use it positively. So that's brilliant. I really like that one. So have you got any other case studies like that?
Yes, there is also a lovely client of mine, and I've been seeing her since I started breathing practice probably 5 years ago, one of my very first ones. And she wasn't even able, she first came to my clinic because her consultant said, well, you've got high risk, cardiovascular risk factors, so go and see her. She'll help you to slow down your heart rate and help you to slow down your stress levels. And she also worked with a nutritional therapist. And so her first session, Eva, was purely talking and moving. Her mind was so erratic and it was such a mess. But with this, I just want to say that she's now a person that meditates every single morning, 15-20 minutes. She probably does better than I do. Every single day, 15-20 minutes. She does her exercise. She lost 17 kilos. She's an extremely healthy and centered person. So yeah, that's another case study. And for me, she was probably one of the most severe cases of nervousness and anxieties because of her workplace.
That's awesome.
Yeah.
Awesome.
And another case I actually had not long ago, when we were discussing about the antidepressants before, is a lady in her mid-40s, late 40s, who's just recently been prescribed antidepressants. Premenopausal and all the stuff. So when I first see her and I do the breathing assessment, she's got a horrendous way of breathing, which is called reverse breath. So basically she breathes like this. So she is constantly hyperventilating. It has taken me 3 weeks, and I see her 3 times a week. This is how long it can take. So for her, consistency is the key. There's no way that she can skip one day practicing, rib cage and belly breathing. So this is a very severe case of someone that has been to respiratory physicians, psychiatrists for stress, for anxiety, and is basically the way she's breathing. She's hyperventilating. She's stressing all the time. She's got the cortisol high, up in the roof, and is one of the most severe cases I've seen in a long time.
But that's exactly it. As we said, those breathing patterns, the reverse breath, as you said, that will negatively affect your hormones. And so we didn't mention cortisol specifically, but of course, people, I'm sure, are realizing that if you're not clear, if you're not breathing properly, you're not bringing yourself down into the rest and digest and heal response, etc. So that is how it is linked to healing. And of course, if you have this constant cortisol exposure and elevated cortisol, that, as we know, leads to a lot of problems. For those maybe who are not really that aware, so people are listening and thinking, well, I'm not sure whether I'm breathing correctly. Well, am I hyperventilating? Am I breathing right? Am I not breathing right? Well, for starters, most people, if they haven't practiced this or haven't done any breath work ever, the chances are they're not breathing properly, right? I think that's safe to say. But perhaps you have some tips for people what to look out for in terms of recognizing how bad their breathing is.
Right. So as simple as just really making sure that when you inhale, your belly should expand out, right? Like going out. And your rib cage as well should move outwards, right? And then your chest move up and down slowly and slightly. We're talking about when someone is sitting on a chair resting, right? Just simply observing the way they breathe. So the belly expands a bit more than the rib cage, and the rib cage expands a bit more than the chest, right? And then slowly that comes back, like belly, rib cage, and chest again. So that's what we call yogic breath, right? So just simply as that, you don't need to, over expand your belly and then over inflate. No, it's just simply as that. making sure that when you expand, your diaphragm goes up and your belly goes up, and then the diaphragm relaxes and the belly comes in, right? And a lot of people think that when you inhale, your chest should go up like that and your belly in. And that's actually, as you correctly said at the very beginning, when we were born with the correct way of breathing. If you observe a baby's belly when it's sleeping, you will see their belly is going up as you inhale and down, right? So belly out and belly in. But as we grow older, this breathing pattern changes and it becomes, erratic.
Yeah. And then with all this sort of pressures, the more stressed and anxious people become, then the worse it gets, and they're feeding into that negative spiral. Yeah. And obviously, under different circumstances, for example, if you're running, if you're doing exercise, that changes, right? I'm just talking about if someone wants to just simply observe the way they breathe in. Also, you can check how many seconds it takes you to inhale and exhale. That's another very powerful technique that we use. It should be a minimum of 2 to 3 seconds when you're at rest, all right? And that it's a healthy breathing pattern according to your heart rate as well, right? And the exhalation should be slightly longer than the in-breath. And that this actually changes when we're doing exercise. The in-breath is slightly longer because all the organs need more oxygen, and the out-breath is shorter because you need to get rid of carbon dioxide a bit quicker, right? But when you're sitting observing your breath, these very simple techniques are amazing. That's the thing, is observing your breathing pattern and even, counting how many breaths you're taking per minute. If it's, 30 or 40, then you're definitely over breathing there, overdoing it, right?
And thank you so much for reminding me this, because one of the techniques that I use as well is I actually teach people how to check their own heart rate while they're breathing. And this is wonderful because you see all sorts of faces, right? But it is a very, very calming and it's a very, very interesting exercise. So you count how many heart rates, how many beats you have per in-breath and out-breath. That's a bit more advanced, but it's also a really cool one. If your breath is shallow, right, we should really be careful here, because you can also see people breathing like that, right, very high in the chest, holding a lot of tension in the throat, which, especially for people with thyroid condition, this is awful, right? And basically where your breath is located, right, things to look up, like if you're breathing with your belly, if you're breathing with your diaphragm, or breathing with your chest, how fast, how slow it is, as I said, where in space. And also, this is a very interesting one as well, but basically just thinking, and also teach this, and I help people to practice that, is that when you are having negative or positive emotions or thoughts, observe the way you breathe. And that changes drastically. If you sit on a chair and you're going to do your breathing exercises and you're thinking about what your boss said to you this morning, certainly this is going to change. If you think about what you're going to do in your holidays as well, the breathing pattern will change. And as I said, I actually trained with Richard Rosen, and he puts this beautifully in his book. When you're going to sit down, and he's a master in breathing exercises and pranayama. So when you're going to sit down and practice your breathing exercises, make sure that your mind is in the right place first. This doesn't really come from me, it comes from Richard Rosen. So make sure that you're in the right place, in the right mindset, and then you can do your breathing exercises.
Yeah, it emphasizes that connection between obviously the thoughts, emotions, and the breath once again. Awesome, absolutely. That's the really, really, great summary and great pointers there. Fantastic, wonderful. I wanted to thank you so much for sharing all these tips. It's just so important that we get it right. But it's interesting that you say, you need to be aware of your breathing and you need to be aware of what's coming to your head. That's double awareness. I know that's going to be challenging for some people. But it's well worth persevering, because when you have that body awareness, so many things will come together for you. One of the reasons why people can be chronically unwell and not even know that for years is because they're lacking the awareness, because the body's always trying to communicate when things are not right. It's just that as humans, we choose not to listen. So developing that awareness at all of those levels is phenomenal and very, very useful indeed. So, Sherry, thank you so much for all this great information and very practical but simple things that people can do. Is there anything else that you still want to add that we haven't? And if not, maybe you can share your top 3 tips for people with autoimmune conditions who want to take their healing to the next level.
Most importantly, number 1 is to be aware of your stressors. As you know, an autoimmune disease can be badly triggered by stress. And that's basically my personal story. It was triggered by a very stressful situation, and then my immune system went crazy. So I can't not emphasize more that nowadays in the world we live, we need to be aware of our thoughts, our stress and behaviors. And it's so important as the food we eat and the products and toxins that we avoid, right? So basically be aware of what's causing this stress in your mind and in your body. That's number 1. The second recommendation is, I'm unfortunately not an expert in there, but is your food and drinks and anything you put on your skin, such as toxic products and things like that. Anyone with an autoimmune condition should at some point visit a qualified nutritional therapist and be really aware that what you put in your mouth will go in your body, will go in your mind, and it's hugely important. Number 3 is probably movement. Being an ex-ballet dancer, for me, movement is a way of expression, a way of communication, and even just very gentle and simple movement, but just expressing yourself through, letting your body move freely. And not many people say that, but movement is a very, very important tool for healing.
Yeah, well, I say that all the time, because to me, movement was one of the key elements for sure to bounce back to health when I wasn't well. Absolutely. And I don't honestly know where I would be without it. I just can't imagine my life without movement. I don't want to. So to me, it is absolutely fundamental. It's one of the pillars of optimal health for sure. Brilliant. Thank you so much. Great tips. Perhaps to sort of end with, is there anything that you wanted to share about your work, or anything else to do with Rhythmia Breath, or anything else like that?
That's really kind. Probably yes. I'm really, really excited because I'm not only specialized in autoimmune disease or cancer, but I'm very focused on cardiovascular conditions and cardiac rehabilitation. So I designed the first teacher training for yoga teachers, yoga therapists, nurses, doctors, complementary therapists, basically everyone that wants to know a bit more about how to manage this type of conditions. So the very first teacher training in yoga for cardiovascular disease and cardiac rehab will take place here in London through Yoga Campus in November, from the 10th to the 14th. Of November, and it's the very, very first one in the UK, and I'm super excited. I'm taking it in to Barcelona, Miami 2019, but the very first one, for a bit more. That's really kind.
Imagine time
through, letting your body move freely. And not many people say that, but movement is a very, very important tool for healing.
Yeah, well, I say that all the time, because to me, movement was one of the key elements for sure to bounce back to health when I wasn't well. Absolutely. And I don't honestly know where I would be without it. I just can't imagine my life without movement. I don't want to. So to me, it is absolutely fundamental. It's one of the pillars of optimal health, for sure. Brilliant. Thank you so much. Great tips. Perhaps you, to sort of end with, is there anything that you wanted to share about your work, or anything else to do with Rhythmia Breath, or anything else like that?
That's really kind. Probably yes. I'm really, really excited because I'm not only specialized in autoimmune disease or cancer, but I'm very focused on cardiovascular conditions and cardiac rehabilitation. So I designed the first teacher training for yoga teachers, yoga therapists, nurses, doctors, complementary therapists, basically everyone that wants to know a bit more about how to manage this type of conditions. So the very first teacher training in yoga for cardiovascular disease and cardiac rehab will take place here in London through Yoga Campus in November, from the 10th to the 14th. Of November, and it's the very, very first one in the UK, and I'm super excited. I'm taking it in to Barcelona, Miami in 2019, but the very first one is here in London. So yeah, that's what I would like to share with all of you.
Awesome, that's great. Well, congratulations. That really sounds like a nice development. Fantastic. And of course, more and more people will be able to take this methodology to the patients who need it. So that's really cool. So thank you yet again. It's been an absolute pleasure talking to you. Absolutely fantastic conversation. Lots of lovely, lovely information. So thank you, Sherry. Thank you so much for being here.
Thank you. Thank you, Eva. It's been a pleasure. Thank you so much.
Thank you very much for watching. If you enjoyed this interview, and if you